So there's a lot of talk about to do Kegels or not to do Kegels if you have stress urinary incontinence. You have to know that the first line of defense is musculoskeletal care. Musculoskeletal care is so important in stress urinary incontinence. You have to teach the floor how to work again in the best positions is really what I want you to know, that these positions are important positions, because if you have a hypertensive floor, I'm maybe not going to do a stop the flow of urine. So that would be, I'm not going to do it in the traditional form of during voiding, but I might teach stop the flow of urine in other positions, even if I have a hypertensive floor. And I know you're probably wondering, what is a position like that? Well, a prime example would be to put your hip abductors on stretch. So I might have somebody who has a tight urogenital triangle. So that's this part of the floor. So this upper part of the floor here is called the urogenital triangle, and this is called the posterior anal triangle. Those two triangles are very significant because they're in charge of different things, even though all these floor muscles actually work together. But if the floor is hypertensive, so it's shorter, tighter than we want it to be, I might then place my person in a position where their hips are adducted, so they're really open. So I might open their hips wide open, and then I have them stop the flow of urine in that position. Why am I doing that? Because think of it, if I have a muscle that's too short and too tight, it can't generate the force tension that it needs to because it's too short to each other. So what do I do with tissue like that? I take that tissue, I elongate that tissue. Once I elongate that tissue, guess what happens? I now have a better tension and length tension relationship to this muscle tissue. So guess what? Once I open their hips up, now I can get a way better contraction to the urethral sphincter.